Good morning and welcome to The Other Side. On this show, we invite interesting people who have made a difference in their sphere of influence. We explore the life of the guest and then ask the guest to walk to the other side with us. On the other side, we urge the guest to look at ideas and situations different from their own. I have Deborah Cannon with me today. Don't let her good looks and a disarming smile fool you. She is a trailblazer. Deborah spent nearly 30 years with Bank of America, rising through the ranks to lead several regions, including 3.5 years in Brazil, pioneering efforts in South America for the bank. In a dizzying career through the banking industry, which included a trek through the Amazon, Deborah set several records as a banker, but as a woman, she has stood tall in an industry where men claimed dominance. She then led the Houston Zoo for 10 years, taking it from a city-run animal cage to one of America's top zoos. She helped raise hundreds of millions of dollars and corral the Houston elite to lift the zoo and the animals therein to a place they have never been before. She became the female version of Noah himself. She is the chair-elect to the board of Memorial Hermann Health System. Deborah, welcome.
Thank you. Thank you for inviting me.
I can't resist with the number of years that you've been in the banking system, Deborah, to at least ask a few questions on the banking. So what were you doing in Brazil?
Well, I was trying to loan money in Argentina, Chile, and Brazil, and make money for the bank in doing so. And so we did, that was very successful.
Was that a sort of a new thing that banks did, or was Bank of America one of the first to get out there?
Well, most of the big banks had offices there even before we did. I was actually with a predecessor of Bank of America at that point in time, Republic National Bank of Dallas. And when I went down, while I was living in Brazil, I really went down to open up business in Argentina and Chile, because this was in '78, and if you recall the turmoil that both of those countries were in, we had no relationships there. So
when was the Brazilian default on the debt? Was that before that?
It was after that.
Okay, okay.
Well, and we say default. There were issues. Of course, Brazil's got some issues these days too.
Even now. But you were in some trouble spots then. Brazil, Argentina, Chile. I mean, you know.
Yes.
So what was that interesting time?
Well, Chile was great. I much prefer Chile to both of them. Very high rate of literacy.
Yes.
Very high educational system. I was there.
No wonder we get some great literature from Chile.
Oh, absolutely.
Yes.
Absolutely. A beautiful country, and as I say, very large middle class. Yes. It's different than many other countries in Latin America in that it has very large middle class and as I say, very high literacy and education levels. So
talking about defaults. What do you think of our banking system now? Is it safe? Is it, you know, we are coming down from a really tough period?
Well, yes, it's very safe.
Yes.
I think it's incredibly overregulated today.
But why is it safe now?
The issues that we saw in 2008, 2009 were really related to a very small part of what banks did. They were really revolved around the subprime mortgage business.
Yes.
And by and large, that's no longer a product that's out there. But
we don't do that stuff anymore then?
By and large, we don't.
Okay. So we do some of it.
Well, in fact, the Obama administration is trying to press banks to start doing that again.
Oh, I see. Okay.
So, you know, it's...
That will be ironic.
It is. It's very ironic. But we've gone to be really overregulated. And so it's very costly for all of us. It increases the cost of banking. It makes it harder to acquire credit these days because of the overregulation. So we've gone, you know, as so often happens, we've gone full cycle.
Pendulum swings.
Absolutely, and we've way overcompensated again.
But so you don't see a situation like that coming up again?
I really don't.
Not in the foreseeable future.
I really don't.
Is it because we got rid of that particular cancer, but is it also because we have new regulations?
Well, I think no. I don't think the new regulations really have helped. I think Dodd-Frank is a disaster, frankly.
Yes.
And so, I think again, I think we've swung over this way, and we need to come back to the middle so that we can make it easier to get credit. We go through periods as we.
Yeah,
as
I was
we
just
always
thinking.
have.
I thought the reason why, obviously there are two sides to the story, but the 29 depression, they say it was caused by less regulation because they let banks do insurance and insurance do banking, and they broke the walls.
And
yeah.
I think there's some truth to that.
Yes.
And I do think that a number of banks have gotten to be too big these days.
Yes. Too big to fail?
Well, that's what they say. But I just think that we would be far better off with a little less regulation.
Regulations.
It's really not adding to the security of the system, and it's as I say, it's greatly increasing costs and the difficulty in banking.
So, Deborah, you brought all of the skills and the exposure you had in the banking industry to the zoo, to the Houston Zoo, and you turned that around in a dramatic way. I was a personal witness to that on the board, and I can tell you that that's true. So tell us about let's do a victory lap on that.
Well, what we did is we ran it like a business.
Yes.
And so we thought about creating a great guest experience first and foremost, so that people would want to come back. As you say, we spent, while I was there, more than $140 million in capital improvements. So the zoo is a very different zoo than it was in before privatization.
I remember you set the goal, but we were going to raise $110 million, and then we hit the recession.
Well,
and you raised that money through that period.
Well, it wasn't quite that high. It wasn't quite $110 million. But again, we have raised a lot of money, and we make money, and then we put everything that we make every year goes right back into capital improvements the next year. But we've done that based on we created new revenue streams. But first and foremost, we increased attendance dramatically. We went from, we more than doubled attendance.
And how did you do that?
By creating a great guest experience.
Yes.
So that people had a great time. They wanted to come back. They wanted to see things again. We do different keeper talks every day, so your visit 2 days in a row will be very different because you have different opportunities to hear from the keepers about the animals, to see the animals and training exercises. We instituted things like zoo lights, which is fabulous.
And today there's nobody in this town that does not know the zoo, at least, and they have visited it at least once a year.
Well, we hope
right?
so. We hope so.
Well, your numbers are showing that. I mean,
yeah, absolutely.
You doubled the membership. I mean, it's amazing.
Quadrupled membership.
Quadrupled.
Yeah. Well, it's a good deal to be a member. So,
I think so. I think so.
My daughter and granddaughter go to the zoo probably 2 or 3 times a month, and because it's educational and it's fun, and it's a great experience. So
Deborah, now you added another feather to your cap, incoming chair of the Memorial Hermann System. Congratulations.
Thank you.
What an honor. What an honor.
Thank you.
Well deserving, though.
Well, we'll see.
You served on so many boards, both for-profit, non-profit, and so it shouldn't be that much. They're lucky to have you.
Well,
for all of the exposure, and especially
we're lucky to have the system here.
Especially of the context you have in this town. I mean, you know everybody out here.
I know. I don't think that's true anymore. But
so let's talk about that, and then we'll probably go to a break very soon, and then we'll come back and attack Obamacare.
Okay.
But for the moment, tell me a little bit about the Memorial Hermann System.
Well, we have 13 hospitals. We have about 220 retail outlets. Now that's ambulatory surgery centers, it's imaging centers, it's sports medicine. So there's a number of, it's called convenient care centers. So we're basically all over this community.
Yes.
And the focus for the community, for the health system.
But as soon as there are 10 homes, there's a memorial hospital.
Not quite, but
Yeah.
the focus has really been on delivering quality care and becoming a high reliability organization. You know, every year in this country, somewhere between 200,000 and 300,000 people die in hospitals from conditions that have nothing to do with what they went to the hospital for. So, you know, we looked at that 10 years ago and said, no, that's unacceptable, and we're going to institute processes and procedures so that we aren't dangerous.
Did you mean by that, you know, some errors or
errors,
infections?
It's all infections. It's punctured lungs. It's it's acquired pneumonia from ventilators. I mean, in many hospitals, it's wrong side surgeries. I mean, there's all sorts of harm that is done to patients.
So what do you guys do to minimize that?
We have. Texas is somewhat unique, and Houston even more so, in this country today, in terms of we don't have large, huge employed physician groups, which most places in the rest of the country do.
Now, the relationship between doctors and hospitals has been a kind of a difficult one to manage.
It has historically, and that's part of the problem we have in this country.
Right, and then, you know, the compensation, the revenue issues, how you sort of manage that has been a problem. So we'll talk about that when we come back.
We absolutely will.
Okay, all right. Well, we're talking to Deborah Cannon. We'll be back in a few minutes.
On The Other Side, we interview a variety of people and seek to examine their beliefs, their opinions, and their passions. Then we invite them to come with us to the other side and look at the antithesis of their views. What comes out is an in-depth conversation without the vitriol of the talk shows, but a cerebral engaging of ideas you will not find anywhere else. Come join us on alternate Saturdays on this channel. If you'd like to recommend a guest for The Other Side, contact us at the email address on the screen.
Welcome back. We're talking to Deborah Cannon. Deborah, we were talking about the memorial hermann system. We drifted into talking about doctors, and then we wanted to talk about healthcare in general.
Absolutely.
How is it? How are we doing as a nation? How are we managing our healthcare? What are your thoughts on that?
Well, one, I think most people would tell you we have the best healthcare system in the world, which is not true.
You're not going to say that it's not true.
It is not true.
Okay.
From a health standpoint, we probably have the best emergency care system, but not the best healthcare system.
I see.
So if you look
or would it be accurate to say that we have the best technology?
Well, we may have the best technology.
Okay.
We spend, in this country, about $8,500 per capita per year on healthcare expenditures. Now that is double what all the other 10 similar countries, so New Zealand, Australia, Canada, UK, Western Europe.
So when you say we are spending, does that mean the government is spending, or
well,
is it
it's across the board?
Across the board. So just
healthcare expenditures
cost
in general.
of healthcare. Okay, all right.
Yeah. So we're spending twice as much, and we're ranked. If you look at again the 10 countries that most resemble us, we're 11th in terms of quality of care or overall. And if you look at longevity, life expectancy, we're 34th. We're ranked 34th in the world. So
Deborah, one of the things that I'm finding out that more and more, I have a morbid interest in obituaries, and I look at that and I see that more and more people are dying earlier and earlier. You see 70s and 60s rather than the 80s and the 90s. Is there some correlation to how we are handling our health?
I think so, absolutely. If you look at cancer and heart issues, experts in those fields will tell you there are 5 ways that you can dramatically reduce the incidence of cancer and the incidence of heart disease. It's eating a healthy diet.
Yes.
It's exercising, not smoking, not being obese, and then moderate drinking.
Right.
And so, but if you look in this country, we have a very high level of obesity.
Yes.
Far higher than any other country in the world. And that leads to a lot of illnesses and, expense for us and for the government.
And that's easy to see from your childhood. You're eating all kinds of crazy stuff.
Well, junk.
And then obviously, it doesn't go away. It kind of sticks around. And then you end up with all these
Chronic
diseases, chronic diseases, heart disease, cancer, diabetes.
Well, diabetes is an epidemic in this country.
It's huge.
Yeah,
it's
no.
huge.
And diabetics have a far less quality of life and longevity. So, it's a real problem. It's a huge problem.
I mean,
and the cost is incredible.
And it's rising, and then it's kind of creaking under all this weight.
Well, it is, and so we're talking about cost and the fact that we spend so much more than twice what other countries spend. If you look at percentage of GDP, it's 17.6% of GDP in this country, and rising, and going to continue to rise, because the Affordable Care Act has really done nothing to address the cost of health care.
Okay.
So,
So I thought creating the exchanges was going to do that.
Well, no. What the exchanges,
would a single payer system work better? Would we be able to control? I know it's a controversial issue.
Well, one of the issues that we have.
One for Bernie.
Okay. No, I don't think so, unless what we have to address is the elements that are creating the problem. And health exchanges don't do that. Insurance doesn't do that. So again, you think about the cost of obesity,
yes,
which is diabetes and heart issues and cancer. But the other thing we do in this country is we deliver a lot of feudal care. So if you look at all healthcare expenditures in general, 16% of them go to feudal care. If you look at Medicare and Medicaid, 28% of Medicare expenditures are spent in the last 6 months of life. And of those, 90% are feudal. They're not doing anything to enhance the quality of life. All they're doing is delaying the inevitable. And so we have to address that. I don't think we have the political will in this country to address it. But if we don't, we're going to continue to have these outrageous expenditures.
But now we are rubbing against some serious moral issues then.
I don't think so.
Okay.
Death is inevitable. If I delay it a month or 2 months and spend hundreds of thousands of dollars, which is what happens.
Yes.
I'm creating problems for the family I leave behind, and my health, my quality of life is very poor. When you're on all those drugs and needless procedures, it's not good quality of life.
So you think assisted suicide is an option we should have?
Well, personally, I think, did you watch 60 Minutes over the last weekend, Sunday night?
No.
There was a great story about a young woman. She was I believe she was in her 30s, and she had terminal brain cancer.
She moved to Idaho or Iowa, I think.
Or Oregon, I think.
Oregon, yes, where it is allowed, yeah. I knew about her, but I didn't see the 60 Minutes.
It was very interesting.
Very poignant too. Her husband went with her.
Exactly,
yes.
Exactly. But she was able to avoid horrific pain.
Yes.
She probably only, delayed or she probably only accelerated her death by a few months, but avoided horrific pain, horrific problems for herself and for her husband, and was able to die in peace. So I personally think that there is a role for it. I think you have to be careful. I mean, you need to know that you're truly, truly terminal,
Deborah, but also I think the underlying our medicine is that, you know, the philosophical concept of death is anathema. You know, we don't want it. I want to keep the guy alive as long as he
But
can.
nobody gets out of this world alive.
I know, but they try.
Well, that's the problem, though.
Yeah.
You know, and you find a lot of times the patients themselves would be willing
Yes.
to not go through all these extra measures, but the family.
I agree with you. I agree with you. And I was witness to one where the son wouldn't let them
Exactly.
kill their dad. You know, so the poor man suffered, and I saw him, and we were helpless. We couldn't do anything about it.
Yeah. No, all they're doing is delaying death.
And
They're
I don't want to be hanging out.
I don't either. When there's no quality of life, I don't want to be
no
here.
way. Okay, so let's get to the Obamacare.
Okay.
Now, what is Obamacare?
Well, it's really, there are about 4 real components to it. The first was that insurers, they eliminated for insurers the pre-existing conditions.
Right.
Okay, so an insurer cannot turn down an individual because of a pre-existing condition. So that was the first thing. Second thing is they required everybody to get insurance, but the fines are minimal.
Yes.
What happened, and then they expanded Medicaid and created these health exchanges, and that's kind of basically there's a little more to it, but those are the
optional
big,
to the states, though they're expanding Medicaid.
That's right, and they thought the states.
All of them will cooperate.
Yeah, they thought that all of them would cooperate. Only 14 states formed their own health exchanges, so 36 are still government.
Texas is,
And we're not one of them.
Yeah.
Nor, and 19 states chose not to expand Medicaid, which I think is a real problem for Texas, and I'll get into that. But, so 19 states chose not to. We, of course, chose not to. Now, Texas has the largest uninsured population of any state in this country. In fact, 26% of all the uninsured in this country live in Texas.
In Texas.
Right.
If they're not here, they're moving in.
We have 25% of adults in Texas are not insured. 11% of children are not insured. So across the state, we reduced, with the health exchanges, we reduced the uninsured by 21%. The rest of the country reduced it by 41%. So, you know, that it's a problem. And it's going to get much worse next year. And the reason for that is, in Texas, well, let me talk a little bit more about Medicaid expansion. Previously, before the Affordable Care Act, about 57% of the cost of Medicaid was paid by the federal government. Since ACA, 100% is being covered by the federal government, and that will go down to, in 2020, it's 90%, but it caps at 90%.
Caps at 90%.
Caps at 90%.
Okay. So what's the excuse for not doing it?
It's illogical and inconceivable to me why you wouldn't do it.
So that brings me to the issue of why is there such visceral opposition to this on certain quarters?
Well, I think it's Republicans versus Obama, really.
Right. That's what it is.
But we're hurting ourselves.
Yeah, that's what I'm saying. You know, come on, yeah, really.
And so in Texas, there's something called the 1115 waiver, which Texas went out for in September of 2016. It will be 5 years, and it expires. Now, and that is that the federal government has funded via block grants $29 billion in health care that goes to facilities that provide indigent care. And so that has been covering, that's been helping to fill the gap between the uninsured and the insured. Now, that will expire in September of this year. The federal government anticipated that all states would expand Medicaid, And so Florida is 1 year ahead of us in terms of this 1115 waiver program. So theirs expired last year, and they applied to the federal government to renew it. And the federal government declined it, saying, no, all you need to do is expand Medicaid and you'll get the funding for the indigent care. And so we don't believe we're going to get it extended. And that is going to create huge problems in the state of Texas because so many community hospitals and small communities get a lot of funding from this waiver program, and it goes away.
Let me ask you this. So you think if we tinker with ACA, with Obamacare, we can at least get close to solving our healthcare issues?
No. I think we can get close to solving the uninsured, but nothing has been done to address population health, and I think that's where healthcare is headed. Now, there are certain things that are now beginning to come into play. So, we're going from a fee-for-service. So every provider, be it hospital, be it nursing home, be it doctors, be it clinics, they all get paid for services. Where we need to go is where, and we believe that this is where we're headed, is that where you get paid for the population. So, and it's beginning to happen with Medicare. So Medicare has a thing called a Medicare Advantage plan, and that is where the insurer takes the risk.
Right.
And so the government pays, instead of paying a fee for every service provided, they pay you a certain dollar amount for every individual who's enrolled in a Medicare Advantage program.
And you have to manage.
And then you have to manage, and all the providers have to manage care
like the
within
one that they have for the military, right? There is a similar program they have, yes.
And it's called what was called capitation earlier.
Yes.
So you've got to get to that point, but we've also got to get to where we're focused on healthy lifestyles and health, not emergency care, not illness and curing disease. We need to get to where we're focused on population health so that we create healthier populations. So we reduce diabetes, which reduces heart disease, which reduces cancer. We need to be focused on creating incentives for people to lead healthier lifestyles.
Deborah, with that, we're going to have to end this. Thank you so much for joining us. Now you know where Memorial Hermann is going to go, with Deborah chairing it next year. It was a great discussion, Deborah. Join us again on another edition of The Other Side. Thank you.